Well, we've got great audience retention, so thank you for staying for the last. We will finish at 4:30, I promise, and thanks to everyone online as well, because it has been quite interactive and great. So I think we've set ourselves a grand challenge. It's been a terrific 2 days, but my sort of reflections on today, 4 messages. Firstly, it's about assembly. Let's not reinvent the wheel. But to me, I think we've got all the componentry that we can assemble to develop an outstanding, scalable, and trustworthy data research ecosystem. So I think assembly is a first key message. Secondly, the talent has been fantastic. And it's been interdisciplinary talent. And I think that we're in a fantastic position in the UK to mobilize and support that talent to do great things. To do that, we will need to support an ecosystem. And that will comprise academia, industry, the publics, the third sector. But in our world, the most important partner is the NHS, because that is where the impact will actually be translated into. And I think if we're too academic, and sometimes we can be too academic, we will not translate. Yesterday we talked about the convergence of care and research. And lastly, have you heard of Charlie Munger? He was Warren Buffett's best. He died about 2 months ago. But he used to say, show me the incentives and I'll tell you the behavior. And what we've got in our ecosystem at times is misalignment of incentives, whether it's funding, whether it's credit. So we've got to think about new business models. And why did I conclude that? So I'll just quickly canter through some. Wasn't it refreshing to hear Caroline, Matt, and Harry? I talk about data science being the interface between math, statistics, computation, and domain, and our domain's healthcare and biomedical research. Isn't math, statistics, and computation in good shape and good heart? Because they work together. And I think that if we can weave that together with the world of healthcare and biomedicine, the whole will be greater than the sum of the parts. And I would also suggest, as a medic, as a doctor, we need a bit of humility, because we don't collaborate as well as that community, and we should do. So, and I think is Carol still here? Her middle name is Assembly, but it's also Trust, Thrust, and Transparency. And I think we've got a lot of learning to do from Elixir, and we should congratulate Tim, if he's still here, on being appointed to that role. Then we went internationally, and if our vision is to develop and assemble an international mesh network to run experiments across sovereign data capabilities, then we'll need to learn from the work that Danny's done with EU Darwin, and also the wonderful Peter, who's been a real champion for standards. And we need to call out Peter's dedication. He's been doing this for 11 years, and he's as enthusiastic as ever in terms of the world-leading work of the Global Alliance for Genomics Health. Then we went into some of the details. We had a TRE session. I think the future will be pluralistic. It will be commercial, academic providers, and we saw that. But again, I would argue the biggest investment in TREs in the UK is in the NHS R&D program, and we really need to work with them in partnership and showcase the work that we're doing. That's maybe a learning from today. Then we went on to federation, which is where the challenges are huge. But again, through Phil, Rebecca, and Blaze, we see the challenges of federation. So that's another componentry that we'll need to grapple with. And then we had what I'd call major programs. So Seb, Kate, Krish, and Guy, these big major programs, a lot of public investment. Our Future Health Bank's got about 140 million pounds. So they're going to be major in their own field. But if we allow them to silo, then we won't leverage the public investment. So I think those are like the power stations on a grid. And then Jim, fantastic talk. How do we automate the 5 safes so we can demonstrate we're being honest, reliable, and competent in terms of disclosure control? And then finally, all credit to Loic. You know, the future global health challenges are inequalities, obesity, climate change. And I think, Loic, you're at the cutting edge of this internationally in terms of sustainable computing. And finally, a glimpse of the future through Johnny. Thank you for that. It was Gates who said that this era is equivalent to the launch of the iPhone or the discovery of the internet. And I think you've just illustrated that. And you know, the NVIDIA share price is like that graph, because you're now capitalized at $2 trillion. It's a big number, $2 trillion. So we're going to have to work how we work in partnership with industry in a trustworthy way, with transparent business models, with clarity on benefit share. So I think, to conclude, assembly, talent, support the ecosystem with the NHS at the heart of it, and think about how we align incentives at scale. So that's us. I hope you've enjoyed the last 2 days. I know we'll do the usual. Did you enjoy the conference? What did you think of the cuisine? But this is an experiment. Please be honest in your feedback, because we want to improve. We want to support and serve this community as best we can, not just in the next 12 months, but the next 5, 10, 20 years. And Peter Goodhand will be invited back at that time. So there's a huge amount of thanks to the team. It's John, it's Mita. There's a huge amount of folk who made this work. It's the team who've done the IT, which has been fantastic. Carol has forgiven you for her slides. So I actually said the rhythm of the morning worked better, so it was all planned, I know. So that was great. Thanks to the conference venue, because the team here have been very accommodating. And the bad news is, remember I said that I thanked LNER yesterday for not being on strike, but from today, from 4 o'clock, there are no trains south of Doncaster, and that's true. So if you're going to London, you'll be going cross-country. So I'm sorry to be a broker of bad news, but can I thank you all? Everyone's participated. Please do feedback, and we look forward to seeing you very soon as we assemble this ecosystem. So thank you.